All right. So just taking a moment, let's do again, one hand on heart, one hand on belly. Just inviting your awareness in, right into the body. And following the breath across the nostrils and through the nasal passages, even noticing what nasal passage may feel more open. Right, we often change which, we have a predominant nostril that changes. So maybe noticing the airflow, where is it moving? And then into the back of the throat. Where's the tongue? How is that kind of upper palate, back of throat? Does it feel wide? Is there a tension in the hinge of the jaw, back of throat, lower jaw? And then just feeling tops of shoulders, right? The movement that comes with the breath. The ribs expanding, allow them to expand and shrink. And as the diaphragm descends, feeling the waist expand. And shrink. Feeling the breath move in and down and wide and up and out. Good. Two more. Okay, let's start with just a little simple twist. I'm just going to sit side settle on the chair. One hand, you can do hands on either side of the back of the chair or top of the back of the chair. Couple of breaths. Again, feeling back ribs, side ribs. Right, one side of the ribs almost turning away or pulling away from the spine, one side almost turning into the spine. Good, maybe just tipping the head down. And back up to neutral and maybe tipping the head up, just easy. Doesn't have to be a stretch. And center, good. And release, come back to the front. And over to the other side, same thing. Good, noticing the difference. Maybe the sensation is different or the amount of rotation is different. Notice the weight of the feet and the sitting bones. Is one shoulder higher, one shoulder lower? And again, that expanding of the ribs. Again, looking down just a little. And center and looking up. And and center. Good. And then again, swinging the body around to center. Good. Let's do first side again. Again, nice and easy. And feeling the weight of the sitting bones, the feet. Good. Notice if there's any change the second time. Good. One more breath. And back to center. And then over to the other side. Again, just feel the weight of the feet, the sitting bones. Maybe notice if one shoulder is higher, just even in feeling. Couple of breaths. And slowly back to center. Okay, so I'm just gonna do like a little tiny head bob. It's teeny tiny. Little lift and lower of the nose, and maybe even closing your eyes. Well, when we get started. So we're gonna do a little bob, and what we're gonna do, well, first thing is let your head turn to one side. And center again. You don't have to push towards the end range, and just check. Notice what happens. Right? Notice where there's grabs and pulls. Notice if it's coming from the neck to the head or neck to shoulder. And then we're going to do that little bob, nose up and down, and we're going to slowly and teeny tiny movement start to turn the head to one side. Again, doesn't have to be all the way to the end range, and I'm going pretty slow and pretty small. And I'm feeling little, just lots of tissue. Right? There's so many small little muscles, especially neck to head. Right? The suboccipitals are pretty small, and then all the short muscles between the vertebra. And then slowly back to center. And again, wherever it gets grippy, if it gets too grippy, especially towards end range, just start going the other way. And let's go through center to the other side. Again, trying it with the eyes closed just to keep some of those muscles that respond to eye movement quiet. And then slowly, in your own timing, back to center. Good. Just turning the head again. And again, not necessarily looking or pushing or expecting more range of motion. Just notice if there's just more ease or softness around the movement. Good. And then let's turn head to one side. Again, it could be, doesn't matter where, right? We're not going to push all the way to the end range. I'm just going to look down towards either shoulder or chest, wherever. Pause for a moment, take a breath, and then looking back up to the side and back to center. Same side, I'm going to look to that side and look down towards the top of the shoulder. Maybe even let the eyes look down the upper arm towards the elbow. Again, taking a breath. And looking up to the side and forward. Again, looking side, looking down to top of shoulder, down to elbow. Good, maybe even down towards the hip. And take a breath and then slowly back up and center. Good, one more time, looking side, top of shoulder, elbow. Again, pause where it feels right, maybe hip or floor. And we have done this standing. So ribs aren't really I'm gonna shift my ribs just a little bit, but it's not a big movement, but a little bit of shift to one side, maybe the other side, towards the arm, away from the arm that you're looking at. Good, and then maybe a teeny tiny no, just a little side to side with the nose, teeny tiny no. And then soften, head up to side, head to center, pause, breathe, little wiggle. Good, and let's turn to the other side. Actually, my neck is feeling like it wants to do a little bob again between the two sides. So let's come back to center and let's do our little bob, little kind of nose up, nose down. And again, it could be quite slow and maybe even playing with pulling the head back. It doesn't have to be a huge amount of energy, but almost like you're just thinking about lifting the base of the skull up off of the spine and then bringing it back down. So there's a little more awareness of back body. And then take that little bob and let's turn it to one side. Like a little bobblehead, nice and easy. Again, doesn't have to be to your full range of motion. And back to center. And slowly through center and over to the other side. And slowly center. And pause. Okay, let's do the second side. So turning towards that second side, looking down towards the shoulder. Take a full cycle of breath, inhale and exhale. And looking up to the side and forward. And looking side, looking down towards the elbow. Take a cycle of breath. Fuller inhale, fuller exhale, looking up and forward. And again, side and down. Looking at the hip, whatever that means. I'm moving my elbow out of the way, but you can look around your elbow and back up and center And one more, side and shoulder, elbow, hip, or floor. And just letting the ribs do a little shift side to side. Noticing your breath. And then pause the ribs and teeny tiny no with the nose, with the head. And pause and looking up and looking forward. Good. Let's take shoulders up to the ears and back and down, forward, up. Keep them up. Bring him down. Or sorry, keep them up and back and keep them back and down. Bring them forward while they're low. Bring them up while they're forward. Keep them up while you go back. Keep them back as you go down. Keep them down as you go forward. Bring them up as they're forward. And then changing direction. Finding that pattern. Clunk, clunk, clunk. Okay. All right, let's take those shoulders up. Let's take one shoulder forward and one shoulder back and down. Meet in the center and then switching to go around and up. Keep going in that pattern for one more. Good, and relaxed. And then let's see if we can do this, shoulders up, and then opposite arm forward, opposite arm back as you go down, and then switch to go back up. Switch at the top to go down, switch to go up. One more. Good. Good. Awesome.